Today in Anatomy 2, we are going to dissect a sheep heart. Step 1, obtain a preserved sheep heart, a dissection tray, dissecting instruments, a glass probe, a plastic ruler, and gloves. Step 2, observe the texture of the fibrous pericardium. Also note its point of attachment to the heart. Where is it attached? Step 3, if the fibrous pericardium sac is still intact, slit it open and cut it from its attachments. Observe the slippery parietal pericardium that lines the sac and the visceral pericardium, the epicardium, that covers the heart wall. Using a sharp scalpel, carefully pull a little of the epicardium away from the myocardium. How do its position, thickness, and opposition to the heart differ from those of the parietal pericardium? Examine the external surface of the heart. Notice the accumulation of adipose tissue, which in many cases marks the separation of the chambers and the location of the coronary arteries. Carefully scrape away some of the fat with a scalpel to expose the coronary blood vessels. Identify the base and apex of the heart, and then identify the two wrinkled auricles, ear-like flaps of tissues projecting from the atria. The balance of the heart muscle is ventricular tissue. To identify the left ventricle, compress the ventricles on each side of the longitudinal fissures carrying the coronary blood vessels. The side that feels thicker and more solid is the left ventricle. The right ventricle feels much thinner and somewhat flabby when compressed. This difference reflects the greater demand placed on the left ventricle, which must pump blood through the much longer systemic circuit, a pathway with much higher resistance than the pulmonary circuit served by the right ventricle. Hold the heart in its anatomical position with the anterior surface upmost. In this position, the left ventricle composes the entire apex and the left side of the heart. Identify the pulmonary trunk and the aorta extending from the superior aspect of the heart. The pulmonary trunk is more anterior, and you may see its division into the right and left pulmonary arteries if it has not been cut too closely to the heart. The thicker walled aorta which branches almost immediately, is located just beneath the pulmonary trunk. The first observable branch of the sheep aorta, the brachiocephalic trunk, is identifiable unless the aorta has been cut immediately as it leaves the heart. Gently pull on the aorta with your gloved fingers or forceps to stretch it. And repeat that with the vena cava. Which vessel is easier to stretch? And how does the elasticity of each vessel relate to its ability to withstand pressure? Carefully clear away some of the fat between the pulmonary trunk and the aorta to expose the ligamentum arteriosum, a cord-like remnant of the ductus arteriosus. In the fetus, the ductus arteriosus allows blood to pass directly from the pulmonary trunk to the aorta, thus bypassing the non-functional fetal lungs. Cut through the wall of the aorta until you see the aortic valve. Identify the two openings to the coronary arteries just above the valve. Insert a probe into one of these holes to see if you can follow the course of the coronary artery across the heart. Turn the heart to view its posterior surface. Notice that the right and left ventricles appear equal sized in this view. Try to identify the four thin-walled pulmonary veins entering the left atrium. Identify the superior and inferior vena cava entering the right atrium. Because of the way the heart is trimmed, the pulmonary veins and superior vena cava may be very short or missing. If possible, compare the approximate diameter of the superior vena cava with the diameter of the aorta. Which is larger? Which has thicker walls? Why do you suppose these differences exist? Step 9, insert a probe into the superior vena cava through the right atrium and out the inferior vena cava. Use scissors to cut along the probe so that you can view the interior of the right atrium and observe the tricuspid valve. Step 10, return to the pulmonary trunk and cut through its anterior wall until you can see the pulmonary valve. So here you can see the pulmonary trunk.
Okay. That's what 18.
We're looking for
One right here.
the pulmonary valve. So on the inside of the trunk is where you'll find the pulmonary valve.
Let's go down inside and see what we find.
Okay.
Good.
Yep, that looks like the pulmonary valve.
Okay.
Step 11, reflect the cut edges of the superior vena cava, right atrium, and right ventricle to obtain the view seen in the dissection photo 30.8. So this is what we're trying to obtain. Observe the comb-like ridges of the muscle throughout most of the right atrium. This is called the pectinate muscle. Identify on the ventral atrial wall the large opening of the inferior vena cava and follow it to its external opening with a probe.
So travel up that one. So like at the end of the tunnel. Travel up that one. Let's see where it goes.
Step 15, reflect the cut edges of the atrial wall and attempt to locate the entry points of the pulmonary veins into the left atrium. Follow the pulmonary veins, if present, to the heart exterior with a probe. Notice how thin-walled these vessels are. The 19 is the pulmonary vein.
He's from good. So. They have to do this stuff all the time. That's 19. And what is 18, 19? We got the 19. There's
So if we followed it on the
19 is here. We got one right there.
okay.
And that would have been right there. And 17 right there here.
Well, that one is thin,
Yeah.
very thin.
Got that one right there. It's covered. And then right to the one here. And then that one back here. Okay.
Okay. Step 16 is dispose of the organic debris in the designated container. Clean the dissecting tray and instruments with detergent and water and wash the lab bench with bleach solution before leaving the lab.